There have been several significant developments in the spread of COVID-19 in Ontario in the last few hours. Infectious disease specialist Dr. Zain Chagla joins us now with the latest. Good morning, Dr. Chagla.
Hi, good morning.
So our top story this morning is the banning of flights from India and Pakistan because of the variants there. It's called a double mutation. I know you talked briefly about it on the 6 o'clock news last night, but just talk about what a double mutation is of COVID-19.
Yeah, so I mean, first of all, it's not the greatest term because all of these variants have multiple mutations. So, the fact this is called a double mutant, well, even the B117 we described is 5 or 6 mutations. But this really has two core pieces. One, the mutation that we've seen in the South African and Brazilian variants, the 484 mutation, which may evade immunity, and another mutation that was seen in California during their last wave that may increase transmissibility as well as may evade immunity. Now, it's still unclear what these two mean together. It's not as simple as 1 + 1 = 2. They may be more together, so 1 + 1 = 3, or it might be less together. What we are seeing, though, in India is that it is rapidly becoming the most dominant strain there in their genotyping. It's showing up in over 20 countries around the world. And so there is some suggestion that it might be spreading faster than what's around, which is obviously a concern considering what we've seen with the UK variant.
And the vaccines that we have now, would they protect kind of like, I don't want to call it, is it correct to call it the core virus?
Yeah, so current vaccines are effective against our old viruses. We are seeing that at least the current vaccines have some efficacy against some of these mutations. It's unclear, though, if this one does protect. There's some gray level data that's been published by the government of India suggesting that the people who have gotten AstraZeneca or their local vaccine, Covaxin, have had some protection against getting COVID-19, especially in this wave. So we will see. But yeah, that still remains to be determined. I think some of that data will likely come out in the next couple of weeks as we start experimenting with this subtype.
Some frightening information coming out late yesterday from the chief coroner of Ontario saying that he's seeing cases, not a lot of cases, but some, of people with very mild symptoms dying and dying quickly.
Yeah, I mean, I think we've noted this in hospital a little bit, is that, the patients that we are stable, needing a little bit of oxygen, can sometimes deteriorate really quickly and in the course of like hours. It's not, a concern necessarily for every individual in the community, although the odd one might go through this deterioration at home. I think, for all of us, we would encourage people who are sick with COVID-19, who feel like they need to be assessed with their symptoms, to get assessed for their symptoms, recognizing that if people are sick enough to be admitted, we're okay to do that. We still have capacity. We will continue to do that. And we would rather be safe and see people improve rather than letting them deal with it at home if they're meeting criteria for admission. But it is certainly concerning, obviously. And again, it may reflect that there are people that deteriorate really quickly that we can't pick up in time.
Okay. I wanted to ask you a question now on a personal note. I got my AstraZeneca shot on Sunday. I had a very strong reaction. I was off sick on Monday with it. My husband had a very different reaction. He was also off sick, but yet you hear about people having no reactions at all. What causes that?
Yeah, there's a few different things. One is how our immune system is regulated. So, different people's immune systems are either really, on and active versus a bit more suppressed. It doesn't mean the vaccine won't make a response in those individuals, but it's just kind of the way they're programmed. You can give the same vaccine to 2 different people and have 2 different responses. We also know people that have had prior COVID-19 or prior COVID-19 exposures may react a bit worse to the vaccine as compared to those who have not. But there's a number of different features that are both genetic and biologic in that sense. And just it's a good lesson for people is, prepare to maybe have a day or 2 off after you get the vaccine. Again, it's not a bad thing when you get these side effects. It means your immune system is triggered and working. But, obviously it's uncomfortable. And again, you may need to have some time off for it.
Right, because I certainly don't want to dissuade anyone. I'm very, very fortunate that I was able to get the shot when I did. And yeah, don't want to dissuade anybody. And I'm looking forward to getting my second shot, although I have planned ahead that, okay, I may be off the next day. But
fair enough.
Dr. Chagla, thank you for reassuring me for that.
No worries.
Have a great weekend.
You too. Take care of that.